I believe the best way to do this is to first consider the potential benefits or goals of treatment and also the potential harms or side effects of treatment. If it is okay with you, I will tell you about the benefits and harms that are most important from my perspective for your choice. As we go through the list, please ask questions and also feel free to share your perspective about the harms or the benefits. That way we'll get to a shared perspective about what is important to you and what is important to me.
Great, thank you. That makes sense to me. I appreciate the chance to share my perspective and to talk a little bit about the harms in particular and how those might influence my life.
Great, let's dive in. To help us keep track of all the information we're going to discuss, I'm going to use the computer to access a program that's designed to help us to keep track of everything we're discussing. That way you can see as well as hear the information. Is that okay with you?
Yes, I think that'll be really helpful to be able to see it.
The conversation and the computer illustrations will be recorded as well. That way you can access that later through your portal to review as you want.
Great.
The computer program we'll use is called the CLL Mind Map. As you can see, there are 3 decks of cards. There are cards about the benefits, about the harms, and about the options. After I deal the cards from the benefit deck, we'll move them to the benefit line in terms of their importance. Similarly, after we deal out the harms, we'll discuss the harms and then move them along the harm axis. For both of those, we're going to try to determine what's most important to you and me and what's most acceptable to you and me in terms of both the benefits and the harms. The goal of moving the cards in is to rank the benefits and the harms in terms of their importance or acceptability to you and me. That will allow us to better understand which of the options are going to be the better option for you. Let's start with the benefits of treatment for CLL. Currently, we're not able to cure the disease, so I'm going to gray out that card. Okay. When we start treatment for CLL, we like to see some evidence of a response. Most people will have some response in terms of improvement in their blood counts. That we call the overall response rate. That's important, but it's not the most important benefit of treatment. The other benefits of treatment that I'd like to discuss with you include something called progression-free survival. That's a measure of once a disease has responded, how long can we maintain that response, okay? That's an important benefit. The other benefit I want to talk to you about that may help us distinguish between the options is called the complete remission rate. So complete remission means we don't detect any evidence of the disease. Your blood counts are normal, you feel well, and there's no signs of the abnormal lymphocytes. So that, to me, is a very important goal as well. The final goal over here is the overall survival. That's a measure of how many people are alive. Some of those people will have disease or not in remission. And so I think, once again, that would be more of a secondary benefit and not quite as important. I know that's a lot of information, Anne, but does that make some sense to you? Do you have questions?
No, not at this time. It feels like the ones you identified as most important will be the ones that we really want to focus on in deciding which treatment is right.
I think so. Okay, great. Let's turn to the harms next. As you can see, there are more harms to consider than there were benefits. What I'd like to do, Anne, is first focus on the 4 harms that I believe will help us make the decision. And then once a decision is made, we can always go back and talk about what other side effects or harms you would need to think about as you make your final decision that you want to take that treatment. Is that okay?
Yes.
Okay. So the 4 treatment harms that we're going to talk about are atrial fibrillation, bleeding, neutropenia, and something called tumor lysis. Atrial fibrillation is an abnormally rapid and irregular heartbeat. If it's not treated, it can lead to heart failure or strokes. So it's a serious complication. The bleeding tends to be spontaneous bleeding. It's most often in the skin or nosebleeds, but occasionally someone may have internal bleeding, including the brain. Neutropenia is a low white blood cell count of this type of white cells that fight bacterial infections. That leads to an increased risk of infections. And then finally, tumor lysis is a more complicated side effect. It actually is due to the rapid lysis of the cells. They elaborate chemicals as they break down, and if the kidney is not able to flush that out, then those chemicals in the blood and cause an imbalance. The other side effects, once again, we'll talk about, but for right now, I'd like to focus on those 4, if that's okay. So from my standpoint, Anne, I think the risk of atrial fibrillation and bleeding is less acceptable than the other two risks, primarily because these risks are throughout the period of time you're on the drug. Tumor lysis, on the other hand, occurs only in the first 4 to 6 weeks after treating. And while neutropenia may also occur while you're on the drug, it tends to be more easily managed by just reducing the dose or holding the dose of the drug for a while. So those are the 4 harms or side effects I'd like to focus on. What questions do you have about that information?
So I know my family has a history of heart problems. I'm wondering if I should also be concerned about hypertension.
That's a great question, Ann. Thank you for reminding me of your family history. I don't believe a family history of hypertension will affect our final choice, but as we talk through that, we can once again think about that, okay?
Thank you. So these 4 harms you've identified, these are the only ones that are really important in deciding between the different treatment options?
Yeah, thank you. I want to make sure I'm clear. It's the decision about which option. I'm not saying these others are not important to talk about and understand, but they're not going to help us as much decide which option is a better option for you.
Thank you. And then I had a question about neutropenia.
Sure.
I thought that had to do with your hands, your ability to move your fingers. I knit, and that's really important to me.
Thank you for that question. You may be confusing neutropenia with neuropathy. Neuropathy is something that affects the nerves. The drugs, as a rule, in CLL do not cause neuropathy, so I don't think will interfere with your knitting.
Oh, great. Thank you.
Okay, then, our next and final step is to figure out what treatment option will give us the best benefit-harm ratio. So let's deal them out. Once again, there are more options listed than I want to discuss with you right now. If it turns out that the 3 options we discussed, you still want to hear more, I'm happy to explain the different options. So the 3 options that I'd like to talk about are acalabrutinib plus obinutuzumab, venetoclax plus obinutuzumab, and zanubrutinib. Is that okay to do it that way?
Yes. So the ones that we're not talking about, you just feel are less effective or less appropriate for me?
They're less effective, or they're going to have more harm. So,
Okay.
for example, the ibrutinib has more atrial fibrillation than the other drugs, acalabrutinib and zanubrutinib. Okay?
Yeah.
All right. So let's just move them over here. So they're similarly effective. So we're going to move the 3 of them over here. Because venetoclax may have a higher remission rate, I'm going to put it slightly to the right of those drugs, okay?
Mhm.
All right, so now let's look to see what happens. So the acalabrutinib is actually associated with the bleeding and atrial fibrillation, and it does have some neutropenia. So I think it's down here where it's supposed to be. The zanubrutinib similarly is associated with the same 3, but mainly the atrial fibrillation and the bleeding is a big difference. Venetoclax, on the other hand, is associated with the tumor lysis and the neutropenia. So that, to me, suggests that it has more important benefits and more acceptable harms. Based upon our discussion thus far, I would recommend that we choose that option for you. The other thing I want to just point out is you were concerned about the hypertension, and you can see hypertension is actually associated with the acalabrutinib.
Mm-hmm.
So that will avoid that risk for you, Ann. What questions do you have about that?
I don't have any more questions right now. This is very helpful to see the different harms and benefits associated with each of these options.
Great. All right. So what I would suggest is that we tentatively say that this is the option. We'll give you some material through the portal, through the CLL Mind Map, that you can look at more carefully. And if you agree, give us a call in the next day or so, and we'll do the next step and plan the treatment.